Hi everyone, my name is Gcobisa Madlolo. My presentation is on success to access for PrEP and PEP. I will start with success to access PrEP. As I have been accessing PrEP, I am still HIV free, meaning PrEP is indeed working. In Gauteng, there's now a huge rollout of PrEP in public clinics as compared to the previous years. And also, a lot of people now are able to access PrEP as before the main focus was young women and the LGBTI community. With these clinics now rolling out PrEP, this now means money for transport will be saved and no one will miss their monthly dose because of lack of transport funds. During the hard lockdown, we were given multiple doses so that we won't go to the clinic a lot of time, and as no one was allowed to be on the streets. And also, rollouts that are done through NGOs are a success because people trust in NGOs than clinics. Because with NGOs, I feel like their staff is well trained compared to our nurses in public clinics. And also, the nurses in public clinics can be judgmental at times when you go and ask for PrEP. They would say you are promiscuous and say a lot of unnecessary comments. Whereas with NGOs, people trust them because there's no stigma there. When you get there, you get all the services that you need and you live without being charged or without being judged. So with NGOs, a rollout of PrEP is also successful because NGOs also target remote areas where Department of Health can't really reach. For example, in the villages, that's where NGOs are working with people and people trust them. So a rollout of PrEP and PEP done through an NGO also encourages a lot of young people to take charge of their lives. Success to access PEP. PEP is still a very controlled drug in South Africa. It is still very tricky to access in other provinces as compared to Gauteng. In Gauteng, you can engage in a sexual activity today, in a condomless sexual activity today, and then go to the clinic tomorrow. You'll be able to access PEP, whereas in other provinces, they still believe that PEP is meant only for people that have been raped. And also now the expansion of who can PrEP, who can get PrEP in Gauteng is a success. And hopefully in other provinces, it will also get to that stage where they offer PEP to everyone that needs it. And our nurses still confuse PrEP and PEP because the other time my friend needed PEP and I told her to go to our local clinic, and when she got there, she was told that PEP and PrEP are the same thing by a nurse, but she ended up coming back. So we ended up going to a private doctor that was able to give her a prescription, and she was able to buy PEP that way. And also information on the ground as to what is PEP and how does it work. It's still not, how can I put it? We're still lacking on that because a lot of people don't even know that PEP exists, and they just think that PrEP and PEP are the same thing as our nurses would tell them. So PEP is easily accessible in private sectors than in public, because now with public you have to go through testing, paperwork, and then if it's a clinic in the village, you'll be told to go to the hospital. And when you get to the hospitals, you'll still be told that we don't have PEP here, you'll be referred to another hospital. And that for young people can be tiring. some young people can end up saying, I'm just not gonna do this. Whereas with private, you can just go get prescription, then you are given your PEP. In conclusion, I can say that I am very glad that both these prevention measures exist. And also myself, I have the knowledge and the privilege to access them. But unfortunately, I cannot say the same thing about the next girl from my village. That's the end. Thank you.